Hello, and welcome to the Body Fusion Therapy Podcast. I'm your host, Dr. Heather Demirci. In 2016, a study by the CDC revealed that 20% of American adults suffer from some form of chronic pain. That is 1 in 5 adults. There's a great impact that chronic pain can have on your quality of life. It can greatly impact your mental health and can lead to an overuse of opioids. Chronic pain can be a big subject to try to tackle, but I'm hoping that we can start to understand a little bit more of how chronic pain can come about and then how to address and treat it. My objectives today are to try to understand this idea of peeling away the layers of the onion or pulling the loose thread, how stress and chronic pain kind of go hand in hand together, and then what are some key areas to treat with chronic pain? Let's start first with the two kind of ideas or philosophies of how to treat chronic pain. There's this idea of pulling that loose thread and then everything starts to unravel. Or there's this idea of kind of peeling away the layers of the onion. So what do I mean when I talk about those? The idea of pulling the loose thread is that there was one event that was the catalyst for all the pain that kind of occurred, that after that one event in the patient's life, everything kind of started to happen. It was like, I had this accident and then this happened. And then 5 years later, this happened. And kind of the compounding events that all come back to that one event. And once you start to fix the dysfunctions of that one event, or, that one area of the body that needs to be treated that was affected, everything kind of starts to unravel. You've pulled that loose thread and it just kind of starts to come undone. It may take a while to unravel it though, but it does when you start to let go. An example I have of this was I had a patient who was in her 80s and she had been having low back pain for as long as you can remember. Now, when someone says, as long as I can remember I've had this pain, I always ask, okay, well, did you have it in college? Did you have it in high school? Was it really as long as you can remember, or it just seems like you've had that pain forever, right? Because when you're in a lot of pain, it just seems like you always were in pain. But if you actually look back chronologically, I wonder when it is. For this patient, it actually was that for as long as she could remember, she had been in a lot of pain. And we brought it back to when she was 2 years old. Yes, a woman in her 80s. We brought it back to when she was 2 years old. At her birthday party, her dad had wanted to get her pony rides. So he had brought ponies over to the house. And my patient, she was really short. She was short to begin with. I think when I met her, she was just over 5 feet. So when she was 2, she was also pretty short, and she could not get the pony to go. So she tried to push into the sides of the pony, but the pony wasn't budging. And she started to get upset. So what does her father do? He smacks the pony in the butt to get it to go. And from the way she describes it, it seems like it was like a cartoon event where she stayed in one place, the pony took off, and then she just went bam, right onto her tailbone. And she remembers that. So when she was 2 years old, she remembers this traumatic event that occurred where she landed right on her tailbone. Now, her pain that she was coming to me with was more low back pain. It didn't have anything to do with her tailbone. She didn't report any pain with sitting down. And she had had 5 children vaginally and didn't have any issues there. But as soon as I treated her tailbone or her coccyx, her pain got significantly better even within that first session. Within that first session, she already had an improvement of over 50% just from that one treatment, because we had started to pull the thread and kind of unravel. And these other areas of her body that she had been treated for over the years, because remember, she was in her 80s and dealing with low back pain for as long as she could remember, they always kind of went to the side of her pain. They went to her low back, and it was always very stiff. They couldn't get good mobility, and any gains that they had made would always revert back. She'd have this recidivism. Those gains would just come back. And if you understand this kind of hierarchy of the organ systems, if there's this recidivism coming, then you haven't found the true main driver of the injury. There's a reason why the body keeps going out of whack and out of position, and you need to figure that out. And sometimes it's that unraveling of the thread. And for her, it was this tailbone injury she had from her 2-year-old birthday party riding ponies. Now, don't just think that because you treat the one area that everything's just going to magically unravel. No, but what we found was that as we started to clear up this underlying neural tension, fixing the position of the tailbone, everything just kind of started to soften a little bit, and it was easier to pull that thread. And especially as we got further along, the whole thing was just unraveling really quickly, and it didn't take much effort to make these improvements. So rather than that person that you just kind of keep beating your head against the wall, or if you're that patient where you're like, it's always so stiff, and it's not getting any better, it could be that you haven't kind of found that cause yet, that you haven't found the thread that you need to unravel. Or it also could be that you're not the type that the pulling the loose thread end is going to be the fix. It could be that you're the layers of the onion. The layer of the onion analogy is there to kind of explain people that have had accumulation of multiple compensations or multiple traumas or injuries that have led to their overall dysfunction. So it wasn't just one thing. There wasn't one catalyst like the pulling the loose thread end. This is someone that just multiple things have happened that have led them to where they are right now. Each layer is really important and needs to be treated. The hard thing with the layer of the onion is that you have to address the outermost layer of the onion, right? If you actually took an onion, you can't get really to the inside layers before you remove the outside layer. You might be able to make a little incision with your knife into see the different layers of the onion, but you're not truly going to have an effect until you take away the outermost layers of the onion. But realize that you have to work towards the center of the onion, but as you work towards the center, those layers are getting smaller and smaller. So treatment speeds up. So it could seem like it's a little bit of a lengthy process, but as you get away those layers, it starts to become smaller problems that are easier to deal with. Not like the thread though. So it's not as easy because they can be completely different realms of how that compensation or how that dysfunction came about. It's not like it's just the down the road of this original catalyst with the thread. It's more of sometimes a completely different issue, but is blocking you still from efficiency and blocking you from getting to that next dysfunction that you need to be able to treat. My example of layers of the onion type of patient is this woman that came in to me with low back pain, more specifically right low back pain, that had occurred about 5 years ago when she was carrying something heavy and it started to fall and she had to catch it. Now, she had tried for 5 years to get better and it hadn't gotten any better. And at this point, the doctors were frustrated. They didn't know what to do and were kind of blaming her, thinking that she was more perseverating on it and what they call malingering. So she just didn't want to get back to work. She was just trying to milk it for all she could, but that was not the case at all. No one had kind of been able to figure out what was going on here. So it took going back into her past medical histories to start understand these different layers that could be there that could be leading to dysfunction. So she had had an appendectomy when she was younger, and it was an open appendectomy, so a big scar, not the like kind of laparoscopic that they do now. She had had multiple cysts on her ovaries, specifically her right ovary. She had a history of scoliosis, diagnosed when she was in elementary school. And she had this history of low back pain occasionally that would occur. So there was a lot of things, different events in her past that could be leading to the dysfunction that she had when she was trying to carry that heavy object. What they had tried to treat her for was more facet joint dysfunction. So the joints within the back, they had tried doing injections there. They had tried some other procedures and nothing had really improved her symptoms. So for her, we brought it back to first we needed to deal with the neural tension because we're thinking about the hierarchy of the organ systems, nervous system reigns supreme. And because she had this scoliosis that happened when it was first diagnosed when she was in elementary school after she actually had a little bit of a growth spurt. So treated the tailbone and treated the sphenoid bone, the bone the brain sits on, to help address some neural tension issues that she had had. And that improved quite a bit of her pain, but still not enough. So that was more of the outside layer. And then I had to deal with scar tissue from the appendectomy because that was inhibiting how much her pelvis could move, which was straining on her low back. I had to clear up the scar tissue from that. Then I went to the facet joints and actually treating the spine and getting better mobility there. And finally had to go back to the front of her body and deal with the adhesions that had been from the ovarian cysts, especially when they had ruptured. And she had multiple known ruptures of these ovarian cysts. So it was kind of like I had to go back and forth and fully deal with each one of these dysfunctions before we got better. But if I had just gone straight for the facet joints like the doctors had in the past and the physical therapists had done in the past, it wasn't having an effect because I had to deal with other issues first. I had to deal with other layers of that onion before she was able to feel better and get improved movement and to stay with that improved movement. Because when they had just gone for the facet joints, she had minimal improvement and then it would come back really quick. So she was more the layers of the onions. Now you need to understand that it can take longer to deal with the layers of the onions, but you have to remember that for chronic pain to become part of your life, it took years for you to get to that point. So it's going to take more than just a minute for the physical therapist to figure it out to help you get out of pain. Now, you might be saying, oh, I really want to have the pulling of the loose thread pain. Like that's the much better chronic pain type to have, or the layers of the onions sound better. Really, one isn't better than the other. Finding that thread can be really hard. It can be difficult to figure out which one it is. And there's going to be some trial and error with that. Like with all chronic pain treatment, there's going to be some trial and error. So sometimes finding that loose thread can be really hard and take a long time. The nice thing is that when you do find it, it starts to just ease up really quickly. And the layers of the onions, it's also a little bit of a give and take because the nice thing with a layer of the onion is that you will have big jumps in improvement in pain as you deal with each layer. But you have to figure out what's the most important layer. You have to figure out what's the one that's the outermost that I need to work through first. And then we peel it all away. So one's not better than the other. There's two different approaches, but it's good to kind of understand more what your body could be, because then you can wrap your head around what the treatment progression should be and what to expect as you get through. Let's switch gears a little bit and talk about how stress has an effect on chronic pain. Have you ever noticed that when you're stressed out, your pain is worse? There's a real reason for that. I once heard this amazing Dutch pain specialist, Dr. Joe Neese, speak at a conference about pain management and stress. He talked about how this idea of neurons, which are the main nerve cell that most people recognize, neurons, they're the ones that are kind of gathering all this information from your body or helping your body work, but it's also grabbing up those pain signals. So the neurons are the ones bringing the pain signals to the brain. There's these other cells called your glial cells, and they used to be viewed as more of like this scaffolding around the nervous system, kind of help to hold those neurons up and in place. We kind of thought that there wasn't much that the glial cells did. But Dr. Neese was able to kind of shed this light on the importance of the glial cells. Research shows that these glial cells just light up like crazy when they are introduced to stress hormones, especially cortisol. When these glial cells interact with these stress hormones, like I said, especially cortisol, then they just start to light up and they send tons of signals to the neuron, where then the neuron thinks that it's more pain signals. So cortisol, that stress hormone. Have you ever heard of adrenal fatigue? Cortisol is made and released from the adrenal glands. And I think we can all admit that we've been a little bit more than stressed during this pandemic. And a lot of people are dealing with more chronic pain. And it's because of this activation of these stress hormones affecting these glial cells that used to be known as just the scaffolding. So there's a lot more glial cells than there are neurons because they were thought to just be holding up these neurons. they will start to activate and may send those signals to the neuron, and the neuron sends that signal to the brain that all of a sudden your pain area is much bigger, there's more surface area, and that it's also a lot more intense. Now, that's not really the case, because the true injury that your neuron is picking up on is from a tissue damage, we'll say, in the disc of the low spine. And it's picking up that signal, but now all of a sudden, let's add the stress of life, of family, of money, of job, of pandemic, name it, any stress at all of a sudden that cortisol is kind of going through your system, and these glial cells are picking up on it, and they just start lighting up like crazy. So when we say that this stress issue can cause more pain, it doesn't mean that the pain is in your head. That's not what I'm saying at all. I'm saying that the pain that you're feeling is real because the neuron is picking up on pain. But this exaggeration of the pain that happens when you're stressed emotionally, when you're getting these stress hormones dumping into your bloodstream, that pain is a reaction, a chemical reaction to the stress that you're having in your life. So it's not just in your head that your pain gets worse when you're stressed. It actually is getting worse in terms of how your body feels pain. But the actual site of pain, the true noxious stimulus coming to your nerve, isn't worse. It's just that these glial cells, the scaffolding around you, around that nerve, that's making it seem like it's bigger and more intense. And I think it's really important to understand this. Usually my chronic pain patients, it's great for them to be able to make this connection because they'll come in and it's one of those things like, hey, how you doing today? Oh, I'm good, but I've got this and this and this. And they just kind of start spouting off what's happening in their life. And they're like, and then my back is killing me. And it's like, okay, well, let's just stop for a second. I'm not downplaying that your back is really hurting you, but let's just see, when did your back pain start getting worse? Was it when all these stressful events started happening in your life? Could it be that it's that stress that's causing this overreaction and increased kind of uptake of pain? It kind of helps you just frame things in your mind a little bit easier to help understand why all of a sudden your pain's getting worse, because people are like, I don't know what could have made it worse. I didn't do anything. I've been doing my exercises. I've been doing this. I've been doing that. Yeah, it could be that you just need to take this moment and understand how stress impacts your life. So it'd be interesting if you suffer from chronic pain, start to kind of, when it gets worse, just stop for a second and evaluate what's going on in my life. Am I stressed? Is there something that's bothering me? Maybe if we deal with that pain of the emotional pain of whatever it is that's causing that stress, the physical pain will get better. And it'll be more just the actual stimulus that nerve is picking up rather than these glial cells. So just understand how stress can have a big impact on chronic pain and try to just be mindful in that moment. So that kind of brings me to the next topic is, how do we treat this? So let's first talk about stress management. At that same conference, Dr. Neese was able to talk to us about the importance of mindfulness meditation and what he's seen in his work with chronic pain patients. He was able to explain a research project that he had been working on and his team back in Amsterdam. I'm not sure if he was able to have it published yet. I'm not positive about that one. But the premise of the research study was they gave people a painful thermal stimulus. So they gave a heat source to the person's arm. And with that, then the person had to rate their pain on a scale from 0 to 10. Now, it wasn't like they were singeing the skin. It was just something that was like, ooh, that's a little hot. Then they broke them up into 3 groups. One was the control group, where they didn't do any sort of intervention with. The second group, they gave morphine to. And then the third group, they trained in mindfulness meditation for 80 minutes. Now, that doesn't mean that they meditated for 80 minutes. They were just trained in mindfulness meditation for those 80 minutes. And then they redid the thermal stimulus, the painful thermal stimulus. Not surprising, the control group had no change in their pain. The morphine group had a 20% reduction in pain, and the mindfulness meditation, 50%, 50% reduction in their pain. Now, if that doesn't say mindfulness meditation is really important, I don't know what is. Quite a few of my patients, when I tell them, you should really try meditation, they look at me like I'm crazy at first, like, okay, yeah, no, I know I should meditate. But when I tell them about this research study, it's like, oh, right? When we're dealing with a society that has way too much opioids and just given so quickly, and that only has a 20% reduction in the pain compared to mindfulness meditation has a 50% reduction. Yeah, let me tell you, the side effects of mindfulness meditation far outweigh the side effects of opioids. And the side effects from meditation are a more calm state, able to deal with stress better, and less pain. Yeah, I think I'll take those side effects over opioids where I am cognitively impaired, increased chance of substance abuse and addiction, where I'm having, suppression of my heart and respiratory rate, not of my choosing, but of the drug's choosing. And it only gives me a 20% reduction in my pain. Yeah, I think I'm going to pick the mindfulness meditation. So please don't poo-poo it off to the side. I think it's really a great way to deal with your pain because it's free and you're just going to feel better afterwards. I always feel better when I'm stressed and the world is kind of coming crashing in on me, or it feels that way. I take 10 to 15 minutes and do mindfulness meditation, and it's amazing how much better that I feel afterwards. I feel more rested. I feel less pain in my body, and I feel like I'm able to take on whatever challenges were facing me prior to the meditation. So don't push it aside. I think mindfulness meditation is great for chronic pain. It's great for all aspects of life, but especially when you hear about its impact over opioids, it's kind of undeniable. So, what are two structures that I think should be treated for anybody that's dealing with chronic pain that I just find the most bang for my buck? I'm getting kind of the best mobility out of that patient and getting them out of pain quickest. First area is the two anchoring points for the dura. The dura, remember, is that saran wrap around the entire nervous system, continuous through the entire nervous system, central and peripheral. So those two anchoring points are the tailbone, or also known as the coccyx, and the sphenoid bone, the bone your brain sits on. The importance of the dura is that, remember, in the hierarchy of the organ systems, the nervous system reigns supreme, right there with the cardiovascular system. So if there's anything off with the nervous system, if it's deviated, rotated, stretched, or even on too much slack, it's going to cause different compensations through the rest of the body, especially the musculoskeletal system. So if you want to have the biggest effect on the whole system, go after that dura. And the easiest way to do it is those two anchoring points. So the coccyx and the sphenoid bone. That's going to give you a lot of bang for your buck, especially the coccyx. So here's a little bit of anatomy for the coccyx. You knew you weren't going to get away from it with me listening to this podcast. There is your fight or flight response of your nervous system, or called your sympathetic nervous system. And you have chains. There's a chain going down either side of your spine called your sympathetic ganglion chain. And you actually have one, most of those are paired. So every single one of those going down the spine at each level has one on the right side, one on the left side, this kind of bundles of nerves of the sympathetic ganglion chain. There is one that is unpaired, and it is sitting right in the front of your tailbone at the second segment. It's called your ganglion impar. So the ganglion impar has a huge impact on your central nervous system, especially that fight or flight response. So being able to go after that by getting the coccyx, the tailbone, in a better position can decrease any sort of overactivation and tension on this ganglion impar and bring down your whole fight or flight response. Now, if you're not in fight or flight, you're in rest and digest. Doesn't that sound much better than fight or flight? Yeah, I think so too. So the coccyx will get you a lot of bang for your buck in terms of being able to treat that area, and you'll affect a lot through the system, but especially the nervous system. So even if your pain is more of an upper extremity pain, it doesn't matter. The tailbone should be assessed too, because it's an anchoring point for the dura. So I've treated patients where the issue's in their feet, and I fix it by going and treating the sphenoid bone, and vice versa. Pain and numbness down the arm, go treat the tailbone because of whatever it was in their past medical history that brought me there, and their pain starts to go away. So that could be the unraveling of the thread, is going and treating the nervous system. So of one of the areas, you should treat the dura, most likely at the coccyx or the sphenoid bone. The other structure that really works, especially with your fibromyalgia patients or chronic fatigue patients, kind of that realm of chronic pain, is the small intestine and mesenteric root. Now, why would that have an impact? Well, it's a pretty big structure. Right behind that mesenteric root is your blood flow, is your aorta and your inferior vena cava, which is bringing blood back to the heart. So you're going to get better blood flow, which could also decrease some of your blood pressure, because that blood pressure is really affected by how much resistance it has to bring the blood back to the heart. So if you have that blood pumping better, because it doesn't have this restriction of the mesenteric root on the front of it, you can decrease your blood pressure. You also have all your lymphatics going through the mesentery, which is holding up your small intestines. So when you're mobilizing your small intestines and mesenteric root, you're also mobilizing your mesentery. And with that, you're getting better flow of the lymphatic fluids. The lymphatic fluids are important for your whole immune system. Remember, I talked about it before. The lymphatics, the lymph nodes that get swollen when you're sick, they're like the police checkpoints for the germs. So your body is scanning in those areas what's coming through that fluid to see if there's anything that's an abnormal foreign body that it needs to then create antibodies for and attack and cure. So if you can get that lymph flowing through your system, then those police checkpoints are going to be able to work more effectively and catch those little bugs and different bacteria and things that aren't supposed to be in your system quicker and be able to deal with it. It also just makes you feel like there's more fluid going through your body. You just have a little bit more energy when you get your lymphatic system flowing. You will also have improvement of your whole immune system in the sense that 70% of your immune system is within your abdominal cavity, specifically the small intestines. So if the small intestines are able to move better, then there's going to be a better immune response that's going to be occurring. And so catching any of those things that might be making you sick and not feeling well. So the small intestine mesenteric root is really important for those people that just deal with the chronic fatigue and fibromyalgia and just kind of these like pains all over the body that change. It's not always this one. It could be this over here, that over there. There's just not really a set pattern. I think you'd be surprised how much mobilization of the small intestine and mesenteric root can help with those symptoms. Well, I hope from today's episode that you start to better understand the framework of how to treat chronic pain, if you're a practitioner, but also if you're the patient. You need to be able to understand in your past medical history, is this more of there was one catalyst that everything kind of happened from, or have there been multiple traumas and multiple episodes in my life that had led to where I am now? So understanding if you're more of that loose thread or if you're more of that layer of the onion, how was best to approach that and understand the length and time and what you need to go through in your treatments to be able to get better. And while you're dealing with those treatments, how stress can have a big impact on your chronic pain and how you have it within your own ability to decrease your pain by decreasing your stress level and using that mindfulness meditation. It is free. There's no bad side effects. You can really start to work your system to understand, is this real true tissue pain that my nerve's picking up, or is this the glial cells that are getting overactivated from stress hormones? And then finally, what are some structures that you might want to have assessed by a practitioner? So it could be looking at the dura through the sphenoid and the coccyx, or it could be looking at the small intestines and mesenteric root. But I hope you start to understand is that chronic pain doesn't need to become your identity. It doesn't need to become who you are. There's ways to get around it. You just have to be patient and figure out how to help your body best. Thank you for tuning in to this episode of the Body Fusion Therapy Podcast. Please share it with your friends and family, as well as leave a review if you liked what you heard today. We're looking forward to continuing this journey of looking at the body. Tune in next time.